Ladies and gentlemen, members, up next on our shopping list is behavior analysis services. How much are we spending? I'm going to give you a number, and it's a big number, $500 million. That's what we're spending. We weren't spending that. I just go back a few years ago. That wasn't on the shopping list to the tune of which we're ordering right now. If you listened to the Senator Harrell's meeting yesterday, you know that the need for taking care of vulnerable citizens, our young vulnerable citizens, is tough, and we still have a waiting list. We have lots to do, but one of the biggest drivers of that is behavioral analysts. Here to represent their industry is Dr. Mary Riordan. Dr. Mary is represents the Florida Association for Behavioral Analysts right here in Tallahassee. And Dr. Riordan, we're glad to have you here. You spoke briefly, but we're going to give you a few extra minutes, a little bit longer than you spoke earlier this week at Health Policy. So welcome to the committee.
Okay, thank you. It's an important matter, so we appreciate your putting it on the agenda today, Chairman Bean and members for listening. Yes, I'm here on behalf of FABA. We're about 39 years old. We were formed.
Dr. Mary, can you go right at that mic? Yeah,
I'm
there
sorry,
you go.
right there.
That's
okay.
It, yes.
Okay, sorry. So about 39 years ago, we represent the thousands of behavior analysts in our state. We are the second in the country in terms of the numbers of behavior analysts, and behavior analysts in our state serve tens of thousands of Floridians. You've heard a lot lately about the work that behavior analysts do with kids with autism, but we also work with behavioral issues in a number of other folks. We work in nursing homes, not as much maybe perhaps as in other areas, but we do work with individuals with dementia. We work with adults with developmental disabilities. We work with behavior problems in the schools. So our profession is dedicating to help people live more productive lives. There's 50 plus years of research. We focus on behavior. So we're a little different. We look at behaviors. We look at what happens before and after them. We look at how we can teach different skills so that people learn to behave in better ways. So just a quick story. I worked with a family a few years ago, and I started off treatment like most good behavior analysts will. You start off by doing assessment. I went to the family home. I met the family. I met the girl. I tried to figure out what is it that's causing the biggest problem for this girl. And this girl and her family had serious behavior problems. She was doing things to harm herself. She was biting, kicking, scratching, head banging herself. She was biting, kicking, scratching her family. Her parents had to basically spend every minute of every day with her. She couldn't sleep alone in her own bed. One of her parents had to be with her. She couldn't go to school. She couldn't be around any of her peers. So we started over, the assessment took a while. I had to figure out what behaviors were the biggest concern for the families, and then why was she doing them? We looked at the things that happened before and after. What were the most serious things for this family? How could we help them be able to be more of a normal family? And so we started to work on those. I worked directly with the family to change some of their behaviors. What were some things and techniques they could use so maybe she could learn to sleep in her own bed and the parents could actually sleep in their own bed together? How could they get her to take her very important medicines without it being a 2-hour process every morning? And then we had therapists that worked directly with her to teach her to communicate so she didn't have to bang her head or bang her parents' heads in order to get what she wanted. So it was a multi-layered, long, comprehensive treatment program. And that's what treatment for kids with autism sometimes looks like. Sometimes it's more narrow and it's more focused, but that's what a program might look like. It is a specialized treatment approach. It does take specialized training. I was in school way too long than it probably should have taken, but I loved being in graduate school. So, especially once I got here to Florida, I really loved it. But it is not an optional treatment anymore. It used to be viewed as experimental or optional. Nobody thinks it's optional for these kids with autism anymore. It is necessary. And it's been recognized by all these prestigious groups. We've had lawsuits. There was a federal lawsuit in 2012 here in Florida that mandated that AHCA begin to develop a program and these services be provided for kids with autism through the Medicaid program. So not only these prestigious groups, but the parents of children who have this devastating disorder are convinced of the life-changing effects this treatment can have, and they're demanding the treatment. So we have a policy. I'm not going to go into length about the policy because we have Beth Kidder here who could tell you in detail about it. But it does provide this service to children under 21. It starts with an assessment. It starts with behavior analysis, which is really the meat of the treatment. It's up to 40 hours of treatment, and that treatment can include the direct therapy. That might be a therapist working directly with the child. It could be up to 40 hours a week. Could be much less than that if that's what that child needs. And it might involve the parent training, which is a critical thing, or the caregiver training, so that those caregivers can learn to have the same behavior change that the therapist can achieve. And this is a policy that can be provided by a number of different professionals that are outlined here. Not only board-certified behavior analysts, but by practitioners that are licensed under 490 and 491. Okay, so I probably wouldn't be here today if things were going swimmingly.
Mary, I'm going to violate my own rule and ask a question real quick. Who is licensed under 490 and 491? Okay. Everybody knows that, but just for there may be one person that doesn't know it. We want to know who that is.
Okay, those are like psychologists, marriage and family therapists, clinical social workers. So those are the people that would be licensed. Now, the policy does say that you're supposed to have it in your clinical practice, and you're supposed to have training in that. But the level of very few psychologists get the level of training that a board-certified behavior analyst would get. Very few. It's many hours of supervised practice, many hours of education. So I wouldn't be here today if this was going really well, probably. It's not going really well. There have been problems. There were some serious events of fraud in implementation of this policy. And, you know, FABA in particular is absolutely committed to helping and working with the department, agency, and the state to root that out. And as a practitioner who's been here for 39 years, I am committed. It breaks my heart to see our field engaging in that. Now, not all the fraud was done by behavior analysts. It was by others as well. But I am also concerned that the solutions being developed not drive out of the field quality providers, that you don't drive the best providers out because the process is so onerous. So we have to make sure that that doesn't happen. And we are continuing to hear about horrendous problems with implementation of this policy. We hear every day from practitioners and families. We hear that some of the services under this policy are being directed by professionals who don't have the expertise that should allow them. They don't have the training and supervised experience to allow them to direct these services and supervise the registered technicians. So we're concerned about that. We hear about the excessive delays in credentialing new staff. It's making it impossible to hire new staff. We hear about well-qualified professionals who are working in our state in other arenas, but they can't become enrolled in the Medicaid program. They're being denied as providers for no known cause. No one's giving them a cause. They're not given an explanation. We're hearing about limits that are being placed on the number of units of service a provider can bill each day, regardless of whether that service is provided on a one-to-one or in a group setting. But the cap is just a hard cap of 10 hours or 40 units a day. And then we hear about the providers not being paid for services that were done in good faith. They were authorized to provide those services, and they seem to be in compliance with the policy. So we're concerned about that. And those things are really having some pretty serious consequences. We're hearing from families who can't find qualified providers. We're encouraging them to call the AHCA line, but we don't know if they do. We don't know if they're getting the qualified. We just hear that they're not getting the services they want. We hear about families who are being put on wait lists. We hear about families like this family here who was getting good services, but then they lose those services and they get put back on a wait list. And so for this particular family, Lori Perry and her son, she was getting great services, and then she lost the services. And she had a chance to see the life-changing effects that the treatment could have, and the big improvements that her son was making in terms of reducing his behaviors. And then she saw those go away when treatment had to be stopped, and she was put back on a wait list.
Dr. Mary, so we're almost at the end of your presentation.
Done.
Okay.
We are done. And then providers are
what do we need to do? What can you sum it up? Can you tell us what advice? So from our perspective, we've got that balance of how to reach so many, and it breaks your heart. Anybody's on a waiting list. And so I know some of the things that you've said are challenges for you, are just, I think, ways that CMS and AHCA have said we want to let everybody have services rather than everybody get too many. I don't know what the answer is, but fraud is certainly there. The members, this is something we'll have to get to each of you. The list, Chair Harrell passed this out yesterday, and there's just a dramatic rise of the cost of services. Kids, there's been a rise of kids getting services, but the cost has just gone up. And if that continues, then it's really going to affect our ability to deliver health care for everybody. So that's where we're here. We're trying to figure out what should we do. Dr. Mary, what should we do?
Okay, so and I saw the proposal or the information that AHCA presented yesterday, and I would support a lot of those things. We would agree that we need to increase the qualifications of the professionals who are providing this service. I think certainly at the lead analyst level, it has to be people who have been credentialed in behavior analysis, because I think those are the people that are most skilled. Then you're going to make sure that the dollars you're spending are being well spent. I think that's critical. I think getting services delivered in a timely fashion, so you're not starting services and restarting them again and again. So this idea that you start them and you have to stop them and put them back on a waiting list and the kids are losing the skills, that's a problem. Some states have made the decision not to individually credential the direct tech and hold the professional, the board-certified behavior analyst, responsible for those people. We have made recommendations to work with AHCA. We're hoping that they can open up the policy and tighten up some of the rules on this. I understand that it's a huge problem. The problem of autism, and that's 90% of where the money is being spent, is huge.
Gotcha, Dr. Mary. Thank you so much. Let's go to questions. Senator Harrell, you're going to lead us off, and then Senator Flores is right behind you, Senator Harrell.
Thank you so very much, Mr. Chairman, and thank you for being here again today. We appreciate your input into this topic, and we are certainly looking for policy decisions as well as appropriations decisions on this. And one of the questions I have is on the certification process. It's my understanding that this goes through AHCA, and there's been significant discrepancies between what the standards are versus how the audits are taking place and from one group to another. Is there a national certification standard for behavioral analyst techs? Is there a national group that does the certification? And would it be of assistance if, say, AHCA depended on individuals receiving that certification from an outside board as opposed to having AHCA do the legwork on the certification?
Yes, there is an international board, the Behavior Analysis Certification Board, that does certified registered behavior technicians. AHCA just put into place the requirement January 1st that all of the techs be RBTs. So that just started, and I think that should go a long way to doing that. And the BACB that certifies those people is reached out to AHCA to try and make that as an efficient a process as possible. So, because I've talked to the head of the BACB, they want to work with AHCA so that they can very quickly document to AHCA the people that are, who have a current certified credential as an RBT. And so there is this international board that will do it. So AHCA does not have to say you're an RBT. They can communicate with them directly on a weekly basis to document that, yes, they're RBTs.
Sure.
In the current process, my understanding, correct me, is wrong, and we can have Ms. Kidder come up and clarify it if we need to. But currently, AHCA is the one that is doing the certifying, and that the National Certification Board for ABT does not if you're certified there, you still have to be certified by AHCA.
You have to be credentialed by AHCA, yes.
Yes. Okay. And are there differences in the standards that AHCA is using versus the standards that the ABT board uses?
There are additional standards, and you're probably better off having Ms. Kidder explain the additional things that they look at.
Thank you very much.
Very good. Senator Flores, you're recognized.
Thank you very much, and thank you for being here and working here. It's a question for you, but we might need Ms. Kidder to come in and provide backup because it's kind of a question for the department as well. You know, we're definitely concerned with fraud that may exist, and you know, we want to make sure that the only people who are providing these services are people who are licensed, should be doing this work, et cetera, to be able to avoid any of the pitfalls you mentioned. But on the flip side of that, I know that at least in Miami-Dade County, I don't know if in other counties as well, there's essentially there's a moratorium on having new people come on board, and so that provides a problem lots of different ways. It adds to a waiting list because you don't have good people that are able to go on and take these services. You know, you have from the provider side individuals who have invested time and money in pursuing this career who are now being told, sorry, but the state, we need more, but we can't have any more. So I guess just overall kind of what are your thoughts on this? And then again, follow-up question to you or perhaps to Ms. Kidder is like, how do we get past this, and when does this end? When do we tell you know, these professionals you know, we're open for business again, because the need is certainly there?
That's sort of our question too. Is if you're a board certified behavior analyst and you're an RBT and that can be documented, what's the need for the continued moratorium?
Yeah, we'll bring Beth in just a few minutes. She's here. Our additional questions. That's a good question. And that's something we need to consider. Additional questions for Dr. Mary. Senator Rader, you're recognized for a question.
Thank you, Mr. Chair. I believe at yesterday's health policy meeting there was a reference to a $25,000 penalty if a denial of certification is appealed. Are you aware of this issue? And if so, could you tell us more about it?
No, that was the first time I'd heard of that. So we do not know that. We've not heard that from any of our members. So, and I reached out to other board members, and we haven't heard that. So I'm not sure what that was about.
Very good.
Okay.
Additional questions. Senator Book, you're recognized for a question.
Thank you so much, Mr. Chair. And Senator Rader, you're right, that was discussed yesterday in Chair Harrell's meeting. And I did ask the provider who brought that concern up. And it was an assessment on, I guess, like going back in an audit. But if Mr. Chair, if you could, when we bring up Deputy Secretary Kidder, if we could get her to clarify that, because we didn't get to that yesterday because the meeting ran short.
Very good. Okay. Super.
Can I ask another question or two? Because you want to...
Bonus question.
There we go. Thank you. Do you have a little more information about how many Medicaid enrolled children are on wait lists?
We don't have good data on that. We have our policy and our practice right now is we are encouraging everyone, all of our members, when they hear that they cannot serve a child, we encourage them to go ahead and contact AHCA, and maybe even to sit down with the family and contact AHCA, because there is a help number. So we're encouraging them to do that.
Kevin, we'll get you that information,
okay.
The wait list information. Either I or Senator Harrell, Chair Harrell, will help you get that.
Yeah.
Thank you, Mr. Chair. Additional
questions for Dr. Mary. Dr. Mary, you have brought some other behavioral analysts or the industry with you this morning. Is there anybody here in the audience that is with behavioral analysts?
I don't.
Is it just you, Mary? Is that what it is?
It's just me. They sent me here with no friends.
Well done. Well done. Dr. Mary, thank you so much. And we're just starting our conversation, and it'll last all throughout session as we put together our budget. But good ideas, good food for thought.
Thank you.
Very good. Thank you very much.